In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 15 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 71. How do you handle multiple patients requiring your attention at the same time? The following are guidelines on how to approach this question. This question assesses your time management, multitasking abilities, and prioritization skills, qualities essential for a community pharmacist. Employers want to know if you can efficiently handle high-pressure situations, ensuring patient safety while maintaining quality service. A strong response should demonstrate your ability to remain calm, communicate effectively, and delegate tasks when necessary. Avoid vague or generic answers that fail to show specific problem-solving skills. Familiarity with the Pharmaceutical Society of Ireland, PSI, guidelines on the safe supply of medicines and the Code of Conduct for Pharmacists is crucial, as these outline the pharmacist's duty of care in prioritizing patient safety and managing workflow efficiently. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When faced with multiple patients needing assistance simultaneously, I prioritize based on clinical urgency while ensuring that all patients feel acknowledged and valued. I quickly assess each patient's needs, address urgent cases first, and communicate expected wait times to others. I also leverage my team's support, delegating tasks appropriately and ensuring consistent workflow. Staying calm and organized is essential to delivering safe and efficient care in a busy environment. By maintaining a professional and empathetic approach, I ensure patients receive the attention they deserve even during peak hours. Example scenario. I remember when our pharmacy was exceptionally busy due to a flu outbreak, and several patients were waiting for prescriptions, advice on over-the-counter medications, and flu vaccines. I quickly assessed the situation, identifying a patient experiencing shortness of breath as a priority. I instructed a technician to prepare medications for routine cases while I managed the urgent case and reassured the waiting patients by communicating expected wait times. This approach ensured patient safety, maintained workflow efficiency, and kept patients informed. As a result, everyone was attended to promptly, and patient feedback was positive. Question 72. Tell me about a time you had to work under pressure. The following are guidelines of how to approach this question. This question aims to assess your resilience, stress management, and problem-solving skills in high-pressure situations. Employers want to see that you can stay focused, prioritize tasks, and make sound decisions under stress. A strong response should include a specific example that demonstrates your ability to manage pressure effectively, highlighting the actions you took and the positive outcome achieved. Avoid vague or overly generic answers that fail to showcase your personal contribution. A good understanding of the Pharmaceutical Society of Ireland, PSI, Code of Conduct for Pharmacists is essential, as it emphasizes the importance of professional judgment and prioritizing patient safety even in challenging situations. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Working under pressure is a common part of a community pharmacy setting, and I have developed effective strategies to handle it. I stay calm, focus on the most critical tasks first, and make use of my team's support when necessary. I ensure that patient safety and quality care are maintained, even when facing challenging circumstances. Managing stress efficiently helps me stay productive, professional, and attentive to patient needs. I believe that prioritization and clear communication are key to handling pressure successfully. Question 73. Why do you want to work in this pharmacy? The following are guidelines of how to approach this question. This question is designed to evaluate your motivation, interest in the pharmacy, and alignment with the pharmacy's values and goals. Employers want to know if you've researched the pharmacy and understand its unique offerings, services, and patient care approach. A strong response should highlight how your skills and experiences align with the pharmacy's mission and demonstrate your enthusiasm for contributing to its success. Avoid generic answers that could apply to any pharmacy, instead, tailor your response to the specific pharmacy. Being familiar with PSI's Code of Conduct for Pharmacists and the guidelines on the provision of services can help you showcase your understanding of professional standards expected in Irish pharmacies. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I am excited about the opportunity to work in this pharmacy because of its strong reputation for providing patient-centered care and personalized services. I am impressed by your focus on community engagement, health promotion, and specialized services, which aligns with my commitment to delivering high-quality pharmaceutical care. Working here would allow me to apply my clinical knowledge and skills in a setting that values patient relationships and professional development. I am eager to contribute to your mission of improving patient health and well-being while continuing to grow as a healthcare professional. Example scenario. During my pharmacy placement, I observed how this pharmacy's proactive approach to patient care made a real difference in the community. For example, I saw how patients received tailored advice on medication adherence and health management, which significantly improved outcomes. This experience inspired me to seek a position here because I want to be part of a team that prioritizes patient care and supports the community's health needs. I believe I can contribute effectively by bringing my clinical skills, dedication, and passion for community pharmacy practice. Question 74. What would you do if a patient presents with a prescription that is missing key information? The following are guidelines of how to approach this question. This question tests your problem-solving skills, clinical judgment, and understanding of professional and legal responsibilities as a pharmacist. Employers want to know that you can handle prescription issues safely and efficiently, prioritizing patient safety while adhering to regulatory requirements. A strong response should demonstrate your ability to recognize and resolve the issue while maintaining good communication with patients and prescribers. Avoid stating actions that could compromise patient safety, such as dispensing medication without clarification. In Ireland, pharmacists must be familiar with the Medicinal Products, Prescription and Control of Supply, Regulations 2003, as amended, and PSI guidelines on the safe supply of medicines, which outline the legal requirements for valid prescriptions. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient presents with a prescription that is missing key information, I would calmly explain the situation to the patient and reassure them that their safety is my priority. I would review the prescription and identify the missing details, then promptly contact the prescriber to verify and clarify the information. While waiting, I would ensure the patient understands the reason for the delay and provide advice or alternatives if appropriate. Once the prescription is confirmed and complete, I would proceed with dispensing and counsel the patient on proper use. My goal is to ensure patient safety while maintaining trust and professionalism. Example scenario. I recall a situation where a patient presented with a prescription for an antibiotic, but the dosage instructions were missing. I explained the situation to the patient and assured them I would resolve it quickly. I contacted the prescriber, verified the correct dosage, and documented the clarification according to PSI guidelines. While waiting, I advised the patient on general antibiotic precautions and answered their questions. After confirming the prescription, I dispensed the medication with clear instructions. The patient appreciated the transparency, and I reinforced the importance of accurate prescriptions to ensure effective treatment. Question 75. Can you explain the role of the pharmacist in antimicrobial stewardship? The following are guidelines of how to approach this question. This question assesses your understanding of antimicrobial stewardship, AMS, and the pharmacist's critical role in combating antimicrobial resistance, AMR. Employers expect you to demonstrate knowledge of infection control, promoting rational antibiotic use, and patient education. A strong response should highlight how pharmacists optimize antibiotic therapy by ensuring appropriate selection, dosing, and duration, as well as educating patients and healthcare professionals. Avoid vague or generic responses that fail to emphasize specific actions pharmacists take. In Ireland, pharmacists must be familiar with the HSE's Antimicrobial Resistance and Infection Control, AMRIC, guidelines and PSI's Code of Conduct for Pharmacists, which emphasize the importance of AMS in protecting public health. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Pharmacists play a vital role in antimicrobial stewardship by ensuring the appropriate use of antibiotics to prevent antimicrobial resistance. This involves assessing prescriptions for appropriateness based on local and national guidelines, providing advice on the correct use of antibiotics, and promoting adherence to prescribed regimens. We educate patients on the importance of completing antibiotic courses and avoiding misuse. Additionally, pharmacists collaborate with other healthcare professionals to optimize antimicrobial therapies and monitor for side effects or potential resistance. By promoting safe and effective use of antibiotics, pharmacists contribute significantly to public health. Example scenario. I recall a situation where a patient requested antibiotics for a sore throat, assuming it was a bacterial infection. I assessed the symptoms and explained that most sore throats are viral and self-limiting, and antibiotics would not be effective. I provided advice on symptom management and encouraged the patient to seek medical attention if symptoms worsened. This approach helped prevent inappropriate antibiotic use and reinforced the importance of responsible antimicrobial use. Educating patients in this way aligns with HSE-AMRIC guidelines and contributes to effective antimicrobial stewardship. Question 76. How do you manage stock levels in a busy pharmacy? The following are guidelines of how to approach this question. This question evaluates your organizational skills, attention to detail, and understanding of inventory management in a pharmacy setting. Employers expect you to demonstrate how you effectively manage stock to ensure medicines are available when needed while minimizing waste and avoiding overstocking. A strong response should cover key aspects like monitoring stock levels, using inventory management systems, handling shortages, and adhering to legal requirements. Avoid responses that overlook the importance of accurate stock checks or proactive management. In Ireland, pharmacists must comply with the Medicinal Products, Prescription and Control of Supply, Regulations 2003, as amended, and PSI guidelines on the safe supply of medicines, which outline responsibilities for handling and storing medicines safely. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Effective stock management requires proactive planning, accurate monitoring, and efficient communication with suppliers. I regularly review stock levels using inventory management software, track expiry dates, and adjust orders based on seasonal demands and prescription patterns. I also maintain strong relationships with suppliers to resolve shortages quickly and ensure timely deliveries. In case of stock shortages, I prioritize essential medicines and offer suitable alternatives where appropriate. By consistently managing stock efficiently, I ensure patients receive the medications they need without delay. Example scenario. I remember a situation where there was a national shortage of a commonly prescribed blood pressure medication. I immediately checked available stock, identified suitable therapeutic alternatives, and consulted with prescribers to make necessary adjustments. I informed patients about the situation, provided reassurance, and ensured continuity of care. This proactive approach minimized disruption, maintained patient safety, and reinforced trust in our pharmacy's commitment to quality care. Such scenarios highlight the importance of effective stock management and strong communication skills. Question 77. What is your understanding of high-tech drug prescriptions? The following are guidelines of how to approach this question. This question assesses your knowledge of high-tech drug prescriptions and your understanding of the procedures, regulations, and responsibilities involved in dispensing these specialized medications. Employers want to ensure you can handle the complexities of high-tech medications, which often include biologics, oncology treatments, and other high-cost, high-risk drugs. A strong response should demonstrate familiarity with the High-Tech Drug Scheme, HTDS, in Ireland, highlighting aspects like patient registration, monthly supply, prescription management, and communication with prescribers. Avoid vague answers that lack specific details about the scheme. A solid understanding of the Medicinal Products, Prescription and Control of Supply, Regulations 2003, as amended, and PSI guidelines on the safe supply of medicines is crucial, as these outline responsibilities related to the dispensing of high-tech drugs. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. High-tech drug prescriptions refer to medications provided under the High-Tech Drug Scheme, HTDS, where expensive and specialist drugs are supplied through community pharmacies. The scheme requires patients to be registered, and prescriptions are processed monthly. As a pharmacist, I ensure accurate record keeping, collaborate with consultants and prescribers, and provide patients with thorough counseling on medication use, potential side effects, and adherence. I also monitor ongoing therapy, ensure continuity of care, and adhere to PSI guidelines on the safe supply of medicines to guarantee safe and effective medication use. Question 78. How would you handle a situation where a GP prescribes a medication that is not covered by a patient's medical card? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's problem-solving skills, patient advocacy, and knowledge of reimbursement systems in Ireland's healthcare system. The interviewee must demonstrate effective communication, professionalism, and an understanding of alternative solutions to ensure the patient receives appropriate care. When answering, avoid criticizing the GP's decision or giving an overly rigid response that does not consider patient-centered care. Instead, focus on collaboration, patient education, and adherence to legal and ethical standards. The interviewee should be well versed in HSE's community drug schemes, including the General Medical Services (GMS) scheme and hardship arrangements under the PCRS, as well as PSI's guidance on patient counseling and professional conduct. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a GP prescribes a medication not covered by a patient's medical card, my first step would be to check whether a covered alternative exists that provides the same therapeutic benefit. I would then communicate with the GP to discuss substitution options or explore a discretionary hardship application through the HSE's PCRS. If no alternative is available, I would clearly explain the situation to the patient, providing guidance on potential out-of-pocket costs and any reimbursement options. My goal would be to ensure continuity of care while adhering to HSE reimbursement policies and maintaining a collaborative approach with the GP and patient. Example scenario. I remember when a patient came in with a prescription for ezetimibe, which was not covered under their GMS medical card. After checking the formulary, I saw that atorvastatin was a covered alternative. I contacted the GP, who agreed to switch the prescription, ensuring the patient could access treatment at no cost. However, in another case, there was no alternative, so I helped the patient apply for a hardship arrangement through the PCRS, allowing them to get the medication reimbursed. These approaches ensure patients receive essential treatment without financial burden while maintaining a collaborative and patient-focused approach. Question 79. What would you do if a patient reports an adverse reaction to their medication? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to manage adverse drug reactions, ADRs, effectively, ensuring patient safety, clinical decision-making, and regulatory compliance. The interviewee should demonstrate strong communication skills, clinical judgment, and knowledge of pharmacovigilance procedures. When responding, avoid minimizing the patient's concerns or making abrupt changes to medication without consulting the prescriber. Instead, emphasize patient assessment, documentation, and appropriate escalation. The interviewee should be familiar with the Health Products Regulatory Authority (HPRA) guidelines on ADR reporting and PSI's Code of Conduct on Patient Safety and Professional Responsibility. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient reports an adverse reaction, I would first assess the severity and nature of the reaction. For mild symptoms, I would counsel the patient, check for possible interactions, and advise on symptom management. For moderate to severe reactions, I would immediately refer them to their GP or emergency care if needed. I would also document the reaction in the patient's record and submit a report to the HPRA, ensuring compliance with pharmacovigilance regulations. Throughout, I would maintain clear communication with both the patient and healthcare providers to ensure safe and appropriate management. Example scenario. I remember when a patient on Ramipril reported a persistent dry cough. I explained that this is a known adverse effect and contacted the GP, who switched the patient to losartan, an alternative without this side effect. In another case, a patient developed a rash and swelling after taking amoxicillin, suggesting an allergic reaction. I immediately advised them to seek urgent medical attention and later reported the ADR to the HPRA. These experiences highlight the importance of early recognition, patient education, and proper reporting to enhance medication safety. Question 80. Can you explain the importance of pharmacovigilance in community pharmacy? The following are guidelines on how to approach this question. Employers ask this question to evaluate a pharmacist's understanding of pharmacovigilance, its role in patient safety, adverse drug reaction, ADR, monitoring, and regulatory compliance. The interviewee must demonstrate knowledge of medication safety, risk management, and their role in identifying and reporting ADRs. When responding, avoid giving a vague definition without discussing its practical implications or failing to mention the pharmacist's responsibility in ADR reporting. Instead, highlight how pharmacovigilance improves patient care, prevents medication-related harm, and strengthens public health policies. The interviewee should be well versed in HPRA's pharmacovigilance guidelines and PSI's standards on medication safety and professional responsibility. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Pharmacovigilance is essential in community pharmacy as it ensures the early detection, reporting, and prevention of adverse drug reactions, ultimately improving patient safety and medication effectiveness. As a pharmacist, I play a crucial role in identifying and documenting ADRs, educating patients on potential side effects, and reporting concerns to the Health Products Regulatory Authority, HPRA. This process helps regulators assess drug safety, update guidelines, and implement risk minimization strategies. Additionally, pharmacovigilance contributes to safer prescribing practices and enhances public trust in medications by ensuring that safety concerns are continuously monitored and addressed. Example scenario. I remember when a patient on warfarin reported unexpected bruising and bleeding gums. Recognizing this as a potential sign of excessive anticoagulation, I immediately reviewed their INR history and advised them to contact their GP for dose adjustment. I also reported the reaction to the HPRA, contributing to national safety data on anticoagulant monitoring. Similarly, a case of a patient experiencing severe dizziness after starting amlodipine led to an ADR report and a discussion with the GP about reducing the dose. These experiences demonstrate how vigilant reporting helps enhance drug safety and optimize patient care. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.